Hello dear students, welcome to GTC classes. In today's MCQ series, I am going to discuss about the Medical Termination of Pregnancy Act, and this act is updated as per the latest amendment which happened in 2021. So we are going to discuss the MCQs regarding this particular act. So let's get started one by one. Question number one is telling you about when does this particular act was passed. When it was passed in 1971, in 1975, in 1996 or 1999. You must be knowing the years. By now you must be very well aware that when we deal with jurisprudence, we must be very much aware of the years which are there. So in 1971, this particular act was passed. Okay, so you must be remembering this particular thing. Next question is Medical Termination of Pregnancy Act extends to. Now this particular question I have deliberately added into your MCQ series because last time I told you something. If you, I hope you must be remembering this thing that last time I told you something that there was a latest amendment after which that Article 70, Article 370 got repealed from our constitution. We know that the Medical Termination of Pregnancy Act now will extend to whole of India except Jammu and Kashmir, whole of India except Andaman and Nicobar Island, whole of India and to the territory outside the India. Now, to be very specific, we know that each and every act are now getting followed all over the India, all over India. That means because the special status, the Jammu and Kashmir was holding a special status, and that's why we always get to know that there are exceptions to the act. Like whenever any act would be there, they will be applied to whole of India, but it will not get applied to Jammu and Kashmir. But after Article 370 got repealed, it got repealed. Now all acts, all the acts will be applied to the Jammu and Kashmir as well. But be very careful in this question because they are asking you about the year which 1971. So this is a previous act, right? So that was applicable whole of India except Jammu and Kashmir, and that's why this is the correct answer as per this question. But if they told, if the question is asking you about like whether this particular Medical Termination of Pregnancy Act latest amendment, latest Medical Termination of Pregnancy Act is extending whole to India or except Jammu and Kashmir, then in that case you must be ticking option B. But for now, if it is asking about 1971, then option A is correct because at the repealment of the Article 370 happens recently. It was not during 1970. It is the a matter of 5 to 6 years, right? Maybe 5 years. So that's why option A here becomes the correct answer. Do apply your mind whenever solving this kind of question. Question number three, medical board under the Medical Termination of Act 1971. Again and again, look at the year which they are asking. They are not asking you the amended one. The amendment happened in 2021, right? So they are asking you the original act. So it is constituted by who constitute this medical board? State government, central government, state government or union territory, central government or union territory. You must be remembering that state government or union territory, wherever the termination of pregnancy will be happening, they will be constituting this medical board. Next question is according to MTP, who is considered a guardian? So there must be guardian who take care of the minor. So that is the definition of guardian. So any adult person, a person with care of a minor, a legal advisor, a person with financial responsibility. So I told you already, a guardian definition which is given in the MTP Act is the person who take care of the minor. Minor is somebody who has not attained the year, 18 years of their ages. So that is considered as a minor. Okay. Question number 5, it is talking about according to MTP Act, the admission register shall be a public document, shall be a secret document, shall be a government document, educational document. So you must have gone through this particular act and you must have seen that the ladies or the women which are getting admitted for the termination of pregnancy, those documents are always termed as a secret document because they are not publicly available for everyone to look at the details of the ladies who are getting admitted and who are getting terminated their pregnancy. So this is a secret document, not readily available. This is not a public document, so that each and every person, according to their wills and fancies, will look onto the documents. Okay, so do remember this particular thing. It is a secret document. It is labeled secret also. Do remember this thing also. A medical practitioner for termination of pregnancy requires specialization in which field? Gynecology, obstetrics, both A and B, and surgery. So this is very easy. Gynecology and obstetrics is the correct answer, option C. What is the minimum experience required for medical termination registered medical practitioner registered before the commencement of MTP Act to terminate a pregnancy? So, what is the minimum experience? How many years of experience? Only 3 years. At least, not only, at least 3 years of experience is needed to become one of the qualified individual to terminate a pregnancy. Question number 8 is talking about, according to the MTP Act, termination of pregnancy can be done by whom? Anyone can do it. Any health care provider, only specialized gynecologist, registered medical practitioner, and pharmacist. So there is a specific mention in the act when you download the particular act. So you get this, that there should be registered medical practitioner who are eligible for this act. So those are only the one who will be terminating the pregnancy. Question number 9, it is talking about that the MTP Act provides the termination of pregnancy can be done under situation by registered medical practitioner when the length is. Now, here what they are talking you about is the medical termination of pregnancy can be done up to what ages or what week. So I think there is a slightly issue here. If it is up to 12 weeks, then it is okay. Up to 12 to 20 weeks, it is also okay. Advice of one doctor is needed as per 1971. I am not talking about the latest amendment. I am talking about 1971. So up to 12 weeks, one doctor advice is needed. Up to 20 weeks, two doctor advice is needed. But about 20 weeks, when it goes about 20 weeks, it is not allowed. Medical termination is not allowed as per the Act of 1971. So here I could say you should remember only this thing. I think there is issue with this particular question. This medical termination can be done if it is up to 20 weeks. So none of the above will be the correct answer. Up to 20 weeks, then it could be done. Not exceed 12 weeks, no, because up to 12 weeks we required the advice of one doctor. From 12 to 20 weeks, we require the advice of two doctors. About 20 weeks, if it is there, it is not allowed as per the 1971 Act to terminate a pregnancy. So the very accurate option is option D. Question number 10, what it is talking about is places where pregnancy may be terminated are government hospital, a place which is approved by government for termination, both A and B, and none of this. Very nicely asked question. Yes, if it is a government hospital, it is allowed to terminate a pregnancy. And when I talk about the places approved, so yes, there must be cases where the government hospital will not be there in the vicinity area. So in that case, the government will give you a place, the approved place. It will get approval of the government for termination of the pregnancy. So these places as well as government hospital, both of them are eligible for the termination. Question number 11, it is talking about places approved for termination may be inspected by. Who can inspect this? Drug inspector, chief medical officer, registered medical practitioner, and MBBS doctor. So it is very easy. State chief medical officer is responsible for the inspection of those places. Why it is inspected? It is inspected for the hygienicity, whether the rules and regulation of the act has been followed or not, and so on the action could be taken. Question number 12, it is asking you about is, as per the Medical Termination of Pregnancy Act, the safe custody of form is with standing committee, registered medical practitioner, owner of the approved place, and the chief medical officer. So there are forms, the admission forms I could say, or the consent form, not admission form, I could say the consent form, and the form which is more specifically related to consent is form C. Okay, you must remember this thing. So this particular form is in the custody of the only owner of the approved places, whichever place the government has approved for the termination, or government hospital owner. Owner of the government hospital, whoever will be the in charge of that particular government hospital, and the owner of the approved places, both of them are eligible for the custody of this particular form are there with them. Question number 13, the pregnancy must be terminated with the consent of woman who has attained her age. I told you minor are the one who are less than 18. So option D here become the correct answer, because if you are less than 18, then the guardian's consent is taken, not yours consent is taken. So it should your age should be higher than the 18 years to be qualified for your independent consent. Question number 14, just now I told you which of the following form is required for the consent. The form C is required. So here you can remember this thing. Form C is required for the medical termination of pregnancy. Question number 15, according to MTP Act, a registered medical practitioner may terminate a pregnancy if he or she has completed at least what? 3 months of house surgery in gynecology and obstetrics. Here the qualification has been asked. 6 months of house surgery in gynecology and obstetrics, 1 month of house surgery in gynecology and obstetrics, and 12 months of house surgery in gynecology and obstetrics. So you must be remembering this 6 months of house surgery is the correct answer. Okay. Question number 16. According to MTP Act, who has the authority to make rules to carry out the provision of the Act? State government, President of India, Central Government, Supreme Court of India. First of all, you must be knowing that making rules and regulation is the department of the government. So President of India and Supreme Court are eliminated from this particular list. So it would be whether state government or the central government. So this authority is carried out by the central government to maintain the uniformity all over the country, to maintain the uniformity of rules and regulations, so that if you are moving from one state to another state, the rules and regulations remains the same, that overall rules and regulation remains the same. There might be slight changes, that is regulations, which might the state government strictness might differ from state to state. So overall rules and regulation will be made by central government. Question number 17 is talking about penalty of imprisonment for not less than 2 up to 7 years occurs when termination of pregnancy by person other than RMP. It is registered medical practitioner, RMP. Okay. Willful contravention or willful failure to comply with the requirement of any regulation. Eugenic abortion of a woman against her will and abortion of a lunatic. Eugenic lunatic, which who are not stable with their mental health. So they are called as, so not less than 2 up to 7 years. This is kind of heinous crime. So termination by the person who is not a registered medical practitioner. In that case, this particular penalty will be given. Question number 18. Who inspect to ensure that the safe and hygienicity has been maintained for conduction of the medical termination of pregnancy? Just a previous question was that chief medical officer. So here the same remains. Chief medical health officer is the person. Chief medical health officer is the person who is responsible for ensuring that the conditions where the abortion is getting, it is safe for the woman's health, for the fetus health. Fetus is not there. So safe for the woman's health. Question number 19. When the length of the pregnancy exceeds 12 weeks but does not exceed 20 weeks, then the opinion of how many RMP is required. Now see, if in any question there is no mention of the year, not mention the year, year is not mentioned, then you must consider that they are asking about the original act. Okay, so you must consider they are asking about the original act. Do remember this particular thing in your mind. So, as per the 1971 Act, when it exceeds 12 weeks but it does not exceed 20 weeks, we require two registered medical practitioners' advice. Okay. Now, but as per the latest amendment, 2021 amendment, what it is talking about, when it is up to 20 weeks, if it is up to 20 weeks, only one doctor's advice is needed. If it is 20 to 24 weeks, then two doctor advice is needed. If it is higher than 24 weeks, then the medical board is constituted. Medical board will be constituted to look case to case situation and will be given notice whether the termination could be happening or not. Okay. Last question. Who is responsible for maintaining the admission register for termination of pregnancy at an approved place? Chief medical officer, head of the hospital or owner of the approved state governor and police officer. Yes, very easy. Head of the hospital. I already told you the owner, head in charge of the hospital or the owner of the approved place is the responsible person who can take the accountability of the register for the termination of pregnancy. So yes, that is all for you guys, and this is very quick series, and I hope you like it and try to interact in the chat box, or else this could be a one-way conversation, will not be very much fruitful. So I hope you understand. Thank you so much.